The healthcare detective Frank Lalli has written a book for Simon & Schuster about how to get affordable healthcare, called Your Best Healthcare Now. It is available online, in-store, wherever fine books are sold. Mr. Lalli is also the health correspondent for Parade and the former editor of Money and George magazines. And I hear he's just gotten even busier. And I hear he's in Philadelphia. And, hi, Frank. What are you doing?
Yeah, you're right about everything. Yes, I'm very busy, but I'm here. Yeah, I'm here in Philadelphia. I'm staying at the AKA Rittenhouse Square Hotel, and we always stay here. It's a fabulous hotel overlooking Rittenhouse Square. There goes all the people walking their dogs. It's fabulous. I come down to Philadelphia often, as I think listeners know. Some listeners know. Because I'm in this clinical trial for my blood cancer, multiple myeloma. So I've got very good news on that score. I am now 2.5 years in complete remission, as I call it. And the other astounding thing was, Jill, yesterday my doctor told me of all the trials for multiple myeloma that I went through, there are about 30 of them around the country. Apparently, my result, complete remission for 2.5 years, is the best result of anybody in the entire country. And they don't want to see me for another 6 months, so I'll get to 3 years at least, and that's awfully good news. So there's a trial that can work for some people. That's me at this point, that out there right on the cutting edge, and so happy to report that. But look, today is not about talking about my health. Let's talk about the health of our listeners. That's what's important. And I think by now, everyone has some level of fear about the coronavirus. Heard so much about it. I mean, only a month ago, this started in China, and now that virus has spread to 48 countries all around the globe. 81,000 cases, probably more. They go up every day. 3,000 people have died. That's just in 1 month. So there's no outbreak in the United States yet, okay? But chances are you're feeling the effects of it. If you've got a 401k, I mean, you've lost 12% of your value. The stock market has just plunged. Something like $2 trillion in wealth has vanished. And worse, President Trump's attempts to dismiss this virus, to sort of happy talk it away, are making people even more nervous. He had a press conference to kind of reassure the country. Well, a day later, the Dow Jones dropped 1,200 points. That's the largest drop in history, and it's down again today. It's down again this morning. I just checked. So he's saying, hey, the coronavirus, it'll be gone. And when it gets warm, he's saying April, it'll be gone. His own Centers for Disease Control say a spread of that disease in this country is inevitable. So he held his press conference, which really amounted to telling Americans to go cross their fingers and let's hope for the best.
Cross their fingers, wash their hands. Wash their fingers, cross them, and hope.
We'll talk about both in a minute. But he puts Vice President Pence in charge. This guy was the governor of Indiana. He says, we've got this great record of health, public health in Indiana.
Your favorite person, Seema Verma.
This is baloney about Pence. I mean, the guy made the AIDS epidemic in that country, in that state, worse. He imposed rules for Medicaid and then made it tougher, and fees of up to 2% of these poor people's income to get Medicaid. So fewer people getting health care. That's not helping public health. It's just the opposite. Plus, he's got a big role for HHS's head, this guy Alex Azar II, as if we needed two of him. This guy ran Eli Lilly.
Right.
He tripled the price of insulin. He's causing people to ration and die from insulin. He's another public health champion.
Who is the HIV person that they appointed on Thursday?
They've got. I'm not sure the HIV. They've got. They've got somebody else. They're bringing some. Well, you're getting to You're getting to my point, because what we're really counting on now are the pros. Okay, the real professionals at the Center for Disease Control, the real pros at the World Health Organization. We're relying on them. And look, these are the people who are left after Trump's repeated attempt to slash the budgets. Right now, he's trying to cut NIH by the National Institute of Health by 7%. He wants to take a 10% cut in HHS, a 16% cut on the CDC, 53% cut to the World Health Organization, and he fired the National Security Council's epidemic expert. That guy's gone, okay, and not replaced. Hell, Trump even misspelled coronavirus in one of his tweets, one of his wishful thinking tweets. So instead of being guided by science, as far as the top of this administration is concerned, Trump is saying, hey, it is what it is. Live with it. Live with it. Everybody's going to be fine. It'll be gone by April. Okay, push that aside, Joe. Let's talk about what we can do to help ourselves get through this scare. It certainly is a scare. So, look, first, go get your flu shot. Now, this is just a regular flu, okay? There is not going to be a virus for coronavirus, a vaccine for coronavirus for something like 9 months, probably more like a year. But the flu itself is deadly. 8,000 people in this country have already died from this season of flu, and that probably is going to get up to 60,000.
How many is that? Say again?
This is a crying... 8,000 have died. It's probably going to get up to about 60,000 people in this country. It's a very bad flu season, just the regular flu. And it's a shame. So few people get the flu shot. Fewer than half of the adults in this country are getting the flu shot. And 70%, under 70% of the children get the flu shot. Their parents aren't taking them for the flu shot. Plus, if you got the flu, then you're weakened. And if you're weakened, then you're more susceptible to getting really hurt if you get the coronavirus, especially as you age. Look, coronavirus death rate is something around 2%, okay? But it goes up to 4% if you're over 60, 8% if you're over 70, 15% if you're over 80. So you don't need a flu on top of that to make you even weaker. If you got hit with this disease, you'll be in serious trouble. Okay. The big worry, one of the really big worries about this coronavirus is that people are contagious apparently for a week or two before they have any symptoms. So it's highly contagious. But on the other hand, I'm saying don't fret about getting a face mask. I'm getting phone calls. Should I get a face mask? I'll walk around the city with a face mask. The face mask you can buy in a regular CVS or something like that, pharmacy. They aren't good enough to actually protect you from the virus. They don't fit right. So I would say get a face mask only with two. Don't get it except for these two exceptions. First, if you have flu-like symptoms, so if you're coughing, you're sneezing, especially if you got a fever, that's a real warning, then put a face mask on because you don't want to spread it to people in your household and others, okay? So you're protecting people around you because when you cough, that flu virus can droplets go flying through the air for at 6 feet, and they can hit anybody who's nearby. So you wear the mask. Second, if you can't sleep at night because you're worrying about it, okay, get a mask. But don't go down to the pharmacy and get one. Get an N95 surgical mask. N95 surgical mask or better. It's going to cost you, ordinarily, it costs about $3 or $4 for each of those. But I can't guarantee that now because there's a run on them, obviously. And the last time I checked, Amazon was completely sold out. There seemed to be other places you could turn. But you can expect profiteering, you can expect spending a lot of money for it just to get the mask. So if you're really worried, you're that worried, fine, go get a mask. But, okay, Jill, you talked about washing your hands.
Before you wash your hands, though, before you wash your hands, I just want to go back to the CDC for a second because this is CDC on their website, again, and linked to via various news outlets, follow CDC's recommendations for using a face mask. CDC does not recommend that people who are well wear a face mask to protect themselves from respiratory diseases. Do you follow them or not? They're very clear. They should be used by people who show symptoms to help prevent the spread of the disease.
Yeah, that's what I was trying to say.
No,
That's exactly right.
I know you said it,
But
and I
if
just
you're nervous about it, right? If it's making you very nervous, go put the mask on. Fine,
okay.
fine, whatever. All right, Jill. Do you know the right way to wash your hands?
Sing happy birthday.
No. Okay, so here's the right way to do it. Once and for all here. First of all, turn on the water. It should be hot. Let it run. Get your hands really wet. Lather up on both sides for that 20 seconds or so, okay? Now, the World Health Organization says keep going. Interlock your fingers and rub hard so you get down into all little crevices in your fingers. Put your thumb in your palm and squeeze it and get your thumb completely clean. Pay attention to your nails, any dirt, anything under your nails, get rid of that. Do that for not 20 seconds. Do it for 40 seconds. Don't just sing that birthday song. Do it for 40 seconds, close to a minute. All right, why am I saying this? People who had SARS, okay, that killed 10% of people who got that. If you wash your hands the way I'm describing it, that reduced your risk of getting that deadly SARS by 30 to 50%. So take a minute and really, really wash your hands. All right. If there's no soap and water around, fine. Use a sanitizer. Make sure the sanitizer is 60% alcohol. Otherwise, it's not strong enough to do you any good. Use the same method as I'm describing to wash your hands. Take that full minute, rub it all over, then let it dry in the air. Okay? That's 1 minute well spent. I'm going to say this. Everybody knows it. If you're coughing, cough into your elbow, not your hands. Then you touch stuff, you're spreading germs all around. You shake hands with somebody, that doesn't do them any good. Next, if you feel at all sick, do not go to work. And parents, don't send your sniffling child to school. Don't do that either.
Okay? Or to play with a friend.
Don't. Just don't. So, unfortunately, in our too cruel system of capitalism that we practice here too often, there's no federal law in this country requiring companies to provide sick days. So something like 25% of part-time workers, we're talking about 27 million workers in this country, 25% of them have no sick days. So if they stay home, they don't get their low wages that they need in many cases to eat, just to function, okay? So what are they going to do? They're going to go to work. Now, Connecticut and Massachusetts have sick pay laws, but they're not great laws, okay? Generally, you only get, this part-time worker only gets about 1 hour of sick leave for 30 to 50 hours of work, and there's often a limit, something like 40 hours of sick leave for an entire year. So what is that? That amounts to what? 5 stinking days a week? Okay, 5 stinking days. If you get the flu, you get 2 bad colds, and I'm just talking about the regular flu. You get 2 bad colds, guess what? You're going to use up your entire sick leave, and and these people who are feeling sick are going to be at work. So here's something you can do, listeners, to protect yourself. Stay away from companies with lousy sick leave policies. And I'm talking about fast food franchises for sure, places like McDonald's. There are other chains that have lousy policies as well. How can you find out? Go on the internet and punch in the name of the company or the chain and look up sick leave policy. And you know what? Up pops the information. And you know a store you might want to go to because they take care of their workers, and you know stores to stay away from. Okay? So that's a tip. All right.
You've got a minute.
Got a minute. What are we really talking about here? We're talking about being an alarmist versus being a realist. And look, I think it's realistic to say the coronavirus is coming. So get prepared for it, right? Get that flu shot. Imagine that you might be self-quarantined for 2 or 3 weeks. So make sure you got all the medicines you need, all the diapers you need, all the pasta, all the canned soup. If you have to stay home for 2 or 3 weeks, you'll be okay. Carol and I are facing it right now. We're supposed to go to Rome. We planned it for a whole year. Should we go? There's an outbreak in Milan. We'll be in Rome, 300 miles away. But what if they close down Rome? or they close the tourist attractions, or they close the restaurants, or we're self-quarantined when we come back into the United States. Should we go to Rome? I don't know. I don't want to be alarmist. I want to be realistic. It could not be a fun vacation. That's a tough decision we're going to have in a week. Okay. There is an excellent chance that you are not going to get this virus. Even less of a chance if you listen to this broadcast, you follow the advice that I offered you today. Hey, stay vigilant, stay calm.
Thank you, Frank, the healthcare detective and the health correspondent for Parade. I've lost my place. Hold on. Thank you, Frank, the healthcare detective and senior advisor to healthcare.com. Send your questions or concerns about finding affordable healthcare to healthcaredetective@robinhoodradio.com. Frank will try to address as many of your questions as he can on future broadcasts. Also, look for his book, Your Best Healthcare Now, available online, in-store, on my desk, and re-listen to the show.